Hello everybody, my name is Dr. Ruti Amir. I'm from Sofwave, and today I would like to introduce the new generation of ultrasound device. The technology is based on intense ultrasound beam array. It's high intensity. The applicator has 7 transducers, as you can see here on the surface. And today, these transducers are operating simultaneously to deliver high energy to the mid-dermal layers, causing collagen denaturation and induction of a healing response that eventually will result in skin tightening in the areas of the face and the neck, and for treatment of wrinkles. As you can see here, this is the device and the screen. There are a few parameters that it shows. Basically, it has the pulse duration. We usually keep it at 5 seconds, and we don't really change it currently. You can play around the energy level going from 3 to 5 joules. And then there is a post-cooling parameter when you can choose between 1 to 5 seconds of post-cooling. So today we are going to treat Victoria, and we are going to do face and neck treatment on Victoria. Victoria is especially bothered from the submental area, and this device is very good for tightening the neck, the submental, for a nice definition of the jawline over the face. As you can see shortly, the treatment is very simple and it goes very fast. Prior to the treatment, I already put some numbing cream on the skin of Victoria. Usually we put the numbing cream between 30 to 1 hour. I usually use high percentage topical anesthetic. It's a combination usually of Lido and Tetra, and it can go between 20 to 30%. And then in some patients, I like to add on that a combination of acetaminophen and ibuprofen. And usually with this type of anesthetic combination, the patient feels very comfortable during the treatment, as you will be able to see shortly. So when I'm going to start the treatment, there is no need to mark the area. The treatment is very simple. Currently, you can see that the machine is in a standby mode. While in standby mode, you will see a blue light on the applicator. I'm going, first of all, because we are using ultrasound energy, I will have to put some ultrasonic gel over the treatment area before I apply the pulses. So I'm shortly going to put Victoria. I'm going to start and treat the right cheek area of the face. Then I'm going usually to follow the neck and submetal, and usually I like to finish the treatment with the forehead area. You have to put enough amount of gel over the face to be able to have good contact between the applicator and the skin tissue. Now, what I'm going to do, I'm going to adjust the treatment parameter according to the patient's feelings. So I will start with lower energy, and I will ask Victoria whether she feels comfortable with that level of energy, and if she is, I can go a little bit higher. So first of all, when I would like to apply the pulses, I'm gonna switch the standby to ready mode. Okay, and it takes few seconds to the device to get into the ready mode, and during that time you can see the blinking of the light in green color. And once it's ready, it will stop blinking, and I actually can apply the pulses on the patient skin. Meantime, I can make sure that the whole treatment area is uniformly and evenly covered with the ultrasonic gel, as you can see here. And I also make sure I have enough gel on the applicator surface. So now the device is already in ready mode. As you can see here, the color was changed to green. Now to apply the pulses, I can use either the foot switch, the pedal, with the foot switch, or I can pulse it with the switch over the applicator itself. So I'm going to apply one pulse, and I'm going to ask while the pulse is delivered, and then you will hear a beep. Now the beep will come after the 5 seconds of pulse excitation and the post-cooling. So currently it was set at a lower energy of 3. Victoria, was it painful, or I can go higher with the energy? Yes. Oh, she said we can go higher, so I'm gonna, okay? Now usually what I like to do is I like to use either 2 seconds or 3 seconds of post-cooling. We know that many physicians are using only 1 second post-cooling, and it's enough for most of the patients. I found that using a longer post-cooling sometimes alleviates the patient's feelings during the treatment. And I like usually to use between 2 to 3 seconds. So I'm going now to go for 3 second post-cooling. I went up with the energy to 3.4, and I'm going to try and test another pulse over the patients. So please note that if we stop the treatment because we would like to move from one treatment area to another, the device will automatically get into standby mode. Therefore, you will need to switch again for ready mode. As you can see again, it's blinking in green color, and when it will be ready, it will stop blinking. It will give me a ready mode. Okay, we are ready now to go, so I'm going to do another pulse. How do you feel, Victoria? It's okay? Can we go a little bit higher with the energy? Yes. Okay, so this is the level of energy I like to use. It's between 3.4 and 3.6, preferably 3.6. So I'm gonna use 3.6 joules. I'm gonna do a post-cooling of 3 seconds, and we can now start with the treatment. I'm going to move one pass in a horizontal direction throughout the right cheek, and then I'm going to do a second pass in a vertical direction on the same treatment area. Now, the size of the cheek is about 80 centimeters square. Now, the applicator size is actually 4 centimeters square. So to cover the whole right cheek area, we actually need 20 pulses. Usually I like to use 40 pulses per cheek, so I'm going to do 2 pulses. Each one of them is going to be 20 pulses over the right cheek, and then I'm going to do the same for the left cheek. I try to be very much consistent between the number of pulses in the right side to the left side of the patient. The other important thing is that you can actually choose between 2 modes of operation. One of them is a single mode of operation, where basically each pulse is delivered separately, and you can use the foot pedal to deliver each pulse, or you can use your hand switch to deliver each pulse. There is also a way where you can use continuous mode. In continuous mode, the device will continuously deliver the pulses. It will, each pulse will be 5-second duration plus the post-cooling time that you set up on the machine. And once it's done with each pulse, you will hear a beep, and actually you can move to the next pulse. So I'm going to start in a single mode. Again, I'm using now 3.6 joules per pulse and 3-second post-cooling. I'm going to make sure again that we have a good coverage of the area with ultrasonic gel, and we are ready to go. Usually I do 50% overlap between the pulses. As you can see, the patient is very comfortable during the treatment. There is no pain involved in the treatment. Sometimes some patients, we like to give them some distraction tools during the treatment, such as a squeeze ball, but it's really not necessary, and Victoria actually doesn't need it. She feels very comfortable, as you can see. Now, I usually can glide. I make sure that the skin is tightened, and I'm gliding the applicator over the skin. Are you okay, Victoria?
Okay. Yes.
Thank you. Now, as you can see, I'm treating the whole cheek area. Actually, I'm not afraid from any injury to vital organs, such as neurovascular bundles or the fat, because our depth of penetration is only 1.5 under the skin. So there is no risk of nerve injury. When you are using other devices such as Ultera, there was always the risk of getting damage to nerves that are more superficial than the depths of the transducers, such as the submandibular branch of the facial nerve and the temporal. But here actually you can treat all over the cheek area. I'm going to, over the bone, it's a little bit uncomfortable, so I'm going to reduce the energy. Okay, I completed the first pass of treatment over the right cheek. We have done 25 pulses. I'm going to change direction now. You see, the procedure is so easy, it's so simple, you just have to move on. Glide the applicator from one pulse to another to deliver the pulse. The patient is very comfortable. Some areas can be less comfortable, such as the forehead, where I'm going to reduce the energy. But other than that, you can treat the whole area fluently. It's so simple, so everybody, can learn it so fast. And the whole procedure is going to take somewhere between 30 to 45 minutes to be completed. And afterward, basically, we're going to see only slight erythema, slight edema. It's going to last between 1 hour to 3 hours. But the patient, can put makeup immediately, can go back to work immediately. There is no downtime. And it's very safe, because we are only 1.5 millimeter under the skin and we do not go deeper. Okay, we completed the right cheek area. I'm going to put it now in a standby mode just because I'm moving now to the neck and the submental area. Again, I have to make sure that we have enough gel over the treatment area, as well as on the applicator surface. When I move into a new area, I will do reset in order to know exactly what is the number of pulses that I'm using per each sub-area of the treatment. So to cover the whole neck area, including right, left, and submental, it usually takes about 80 pulses. Again, Victoria was very much bothered by the submental area, and this is an area where many patients are seeking for treatment. And this technology is very good in tightening the skin over this area. I'm continuing with the same mode of treatment. I'm doing 50% overlap between pulses. I'm starting a horizontal direction, then I'm going to do a second pass vertical direction. I make sure that I cover the whole treatment area uniformly. We do want to get high density treatment over the area. If for some reason you are using lower energy, results are still great. You just need to make sure you cover the whole area with high density treatment. Okay, I completed the first pass over the right neck. Now I'm going to change direction and go vertically. The only area in the neck where we do not treat is the area of the thyroid gland. Other than that, the whole face, neck and submental area can be treated completely. Now, if the patient has small face, of course, you can adjust the number of pulses accordingly. But you need to make sure you highly cover the whole treatment areas evenly with 50% overlap between pulses. Okay, we actually completed the right neck area. Now we are going to move to the forehead, periorbital areas on the right side. Now usually the forehead is more painful than other areas just because the skin over the forehead is much thinner. Therefore, I'm going to start with a lower energy and again follow up with the patient according to her feeling. So usually to cover the whole forehead and temples area, it takes another 40 pulses. We are now going to start just with the right side. So I should do again 20 pulses. I'm going to reduce the energy level. I will start with 3.2 and see how the patient feels with that energy level. In addition to significant improvement in jawline definition, we see very nice result in eyebrow lifting in our patients. So it's important to cover the forehead and the temples area. Again, in this area, I'm not afraid from the temporal branches of the facial nerve because we are just going 1.5 millimeter under the skin, and there is no risk of injuring those nerve branches at this depth of penetration. And I don't need to worry about the fact that, some patients are variability in their skin thickness, but definitely, since we are above the 2 millimeter depth, I don't need to worry about injuring any neurovascular bundles over the face and submental areas. Okay, we completed the right side of the face. Now I'm going to move to the other side. I'm going to clean the gel. We are ready to go now to the right cheek area. Again, I'm going to keep consistent number of pulses between the right side and the left side. So we are going to do 40 pulses per the left cheek. I completed the first pass horizontal. I'm going to change direction and do the left cheek with a vertical direction. I'm going to do few pulses over the chin area. We found out that it's very much improving the texture around the chin area. Since it's a little bit more painful over this area, I'm going to reduce the energy slightly. I'm going to keep consistent number of pulses to the other side. We did about 25 pulses over the right side, so I'm going to do 25 on the left side as well. Again, I'm making sure that I'm covering very good the submental area. This is the area where Victoria was most bothered by. I want to make sure that she gets great results over this area. Completed the first pass. I'm going to do the other direction, the vertical direction now. We completed the left side on the neck and submental. Now we're going to finish the treatment with the left side of the forehead and temples and the periorbital region. Again, I'm keeping consistent number of pulses. This area is a little bit more painful than others, so I'm reducing the energy over there. I make sure I use longer post-cooling. Usually I like to use 3 seconds with the post-cooling. But I can treat the whole forehead and the temple areas. I don't need to worry about the temporal branch of the facial nerve. We are almost done. I'm covering completely the periorbital area. And we completed the treatment. She received 118 pulses to the left side and also the same number to the right side. And now I'm taking off all what is left over of the ultrasound gel. We finished, and Victoria can wash her face. We just finished the treatment 5 minutes ago, and Victoria went down to wash her face. As you can see, 5 minutes after treatment, she even doesn't have erythema at all, no edema, nothing. She can, if she wants, she can put makeup and go and have some fun today. She deserves it. And sometimes we do see patients with slight erythema and edema, but Victoria is fortunate enough even not to have this. So go have some fun now. Everybody is going to look at you. We will start to see the results as soon as 1 to 2 weeks after the treatment, and then it takes several weeks until we have the maximal effect. Usually the healing response takes about 12 to 16 weeks, and then if we will reevaluate Victoria and see if she needs another treatment, if she wants another treatment, and we'll give her another treatment. Thank you.